Mr. Speaker.
Order. Questions for oral answer. Mr. Ye Kung.
Sir, the member has referred to a US research paper which, according to media reports, found that the second COVID-19 infections are more severe compared to first infections. I'm afraid the media reports have not been clear or accurate. The paper cited by the member does not compare the severity between first-time infections and reinfections. Instead, it compares the outcomes of those who had a first COVID-19 infection versus those with 2 or more infections. And therefore, not surprisingly, the study found it is more likely for persons to develop adverse health outcomes after 2 or more episodes of COVID-19 infection compared to people who had only 1 infection episode. Put it simply, getting sick twice is worse than getting sick once. But getting sick for the second time is not worse than getting sick the first time. In fact, from September to mid-November 2022, the mortality rate of reinfection cases in Singapore was 4 per 100,000 cases, lower than that for first-time infection cases at 35 per 100,000 cases. The rate of severe illness, i.e. those requiring oxygen supplementation, intensive care or death, was also lower for reinfections at 232 per 100,000 cases compared to first-time infections at 282 per 100,000 cases. Our data also shows that achieving minimum vaccination protection, in other words, 3 doses of mRNA or 4 doses of Sinovac, lowers the risk of severe illness, whether it is a first or subsequent infection.
Mr. Yip.
I thank the Minister for his clarification. Is there any data that the bivalent vaccine booster has helped to reduce severe illness and death? And what is the uptake of the bivalent vaccine? And with the Singapore public treating living with COVID as a new normal, how can we improve the uptake of the bivalent vaccine? Thank you.
Thank you. Both the initial data from clinical trials of the bivalent vaccine and now empirical data based on our actual lived experience show that it has been effective in reducing severe illnesses. Today, when you compare, especially for the aged, those who have gotten full protection and up-to-date vaccination versus those who have not, it still show a significant difference between the prevalence of severe illness if they get infected. I do not have the data with me, but it's still at least 4 or 5 times more likely to fall severely ill if you are not fully vaccinated or not up to date. Today, we are administering healthy numbers of vaccines, about 20,000 a day. Uptake is quite good. This includes both monovalent and bivalent. I don't have the breakdown, but the take-up has been encouraging for people keeping their vaccination up to date. We will continue to put out public messages to encourage people to take their vaccines, keep it up to date, because the pandemic is not over. We will be stepping up our mobile vaccination teams into the heartlands so that especially for seniors, they will find that it's more accessible to getting their vaccination up to date with the mobile vaccination teams in place.
Tempo.
Thanks, Speaker. I just want to ask Minister, is there data to show what is the reinfection rate and the seriousness of using mRNA and others? Thank you.
Sorry, can you repeat that? I wasn't too clear.
Sorry. My question is there data to show what is the effective rates of using mRNA and the seriousness of reinfections between mRNA and others, these two categories? Thank you.
There was a similar parliamentary question before, and I showed some of the data. You should be able to find it in Hansard. So essentially, we use more non-mRNAs, mostly Sinovac. Sinovac is effective if you take 3 or more shots, preferably 4 shots. It does protect you against severe illness. Yeah, I remember the protection rate is about 70%, 70+%. But if you use mRNA, it is even more effective at 80 plus, almost 90%. So both are effective, with mRNA having an edge over Sinovac.